Good morning. Am I audible? Okay. Good morning, all. We are starting with the prayer.
हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना।
Good morning. Giving tribute to our great master Samuel Hahnemann, who have found this divine science and taught us dare to be wise. We are seeking blessings from our Guru, Dr. Prafull Vijayakar sirs, who have bridged this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijaykaraya Namah. So, friends, we are in the journey of reading the fourth book from the Dr. Vijayakar sir's Wisdom. The book is Verbatim. Along with we are reading the Wisdom of Master Hanuman from the sixth editions of Organon. So up till now we have covered many aphorisms. So today we are reading the aphorism number 79. Up to 78, the master has told about that unless and until it is aided by the mechanical means, then and then mechanical means in the form of specific remedy to disease, then and then the miasm can be reversed. Otherwise, miasm cannot be. So this is the process. So to understand this, master is giving the idea about how to treat the miasm judiciously and scientifically. So this is what the aphorism number 79 told about. So in 79, he says that hitherto the syphilis alone has been to some extent known as such a chronic miasmatic disease, which when uncured ceases only with the terminations of the life. So this is what you have to understand, that the syphilis is the miasm which can lead to end of the life, that is the death. So we need to treat that. Psychosis, the condylomatous disease, the growth disease, equally ineradicable by the vital force without proper medical treatment. So vital force alone does not cure this process. They require a medicinal treatment, and they require a specific homeopathic treatment, because artificial treatment does not give rise to treat the miasms. So and was not recognized as a chronic miasmatic disease of a peculiar character, which it nevertheless undoubtedly is, and physicians imagined they had it cured when they had destroyed the growth upon the skin, but the persisting dyscrasia occasioned by it escaped their observation. So this is what understand, the psychosis always escape physician's observation. So psychosis is hidden. So psychosis always deceives you, and physicians feel that whenever I remove the growth from the skin, so psychosis has gone, but actually it is not gone. It is there. Dysprasia is remained there, persisted, and it is escaped from the observations of the physician. That is why Sir has emphasized more on the psychosis. That psychosis is the hidden. Psychosis is the law of psychosis is given by the Sir is CEO, cheat everyone. That is deceiving everyone, to deceive, to hide, and that is what the psychosis is. That is what Master has told about. In aphorism number 80, what Master tells, incalculably greater and more important than these two chronic disease, that means the syphilis and psychosis, miasm just named, however, is a chronic miasm of the sora, which whilst those two reveals the specific internal dyscrasia, the one by the venereal chancre, that is syphilis, and other by the cauliflower-like growth, that is psychosis, does also, after the completion of the internal infections of the whole organism, announced by the peculiar cutaneous eruption, that is the sora, sometimes consisting only of the few vesicles, accompanied by intolerable voluptuous tickling, itching, and a peculiar odor. This monstrous internal chronic miasm, the sora, is the only real fundamental cause and producer of all the other numerous, I must say, innumerable form of the disease. So this is what our modern science also tells about, the every disease start with the process called as functional changes at the level of the cellular mechanism, and that functional change is going into development of the inflammatory process. So most of the disease start from the inflammation, and then it develop to gradually into different process. So here also the master is the real fundamental cause and producer of the all the other numerous, I must say, innumerable form of the disease, which is namely as nervous debility, hysteria, hypochondriasis, mania, melancholia, imbecility, madness. These are the symptoms of the mind. Then epilepsy and convulsions, this softening of the bones. These are the symptoms of the nervous system. All sort softening of the bones, scoliosis, kyphosis, caries. These are the mesodermal origins. Then cancers, the fungus nematodes, the neoplasms, the gout, the hemorrhoids, the jaundice, cyanosis, dropsy, amenorrhea, hemorrhage from the stomach, nose, lung, bladder, and the home, hemorrhage, asthma, ulcerations of the lung, of impotency and barrenness, of migraine, means migraine, deafness, cataract, amaurosis, blindness, urinary calculus, paralysis, defect of the senses, and pain in thousands of kind, etc. All are figuring a systemic work on a pathology as peculiar and individual. All are based on this miasm only, the chronic miasm sora. Now, what Master telling about in the footnote that I spent 12 years in investigating the source of this incredible large number of chronic affections, in ascertaining and collecting certain proofs of this great. Am I audible?
Yes, sir.
Yes, sir.
Yeah, okay, fine, fine.
Yes, sir.
So I spent 12 years in investigating the source of this incredibly large number of the chronic affections, in ascertaining and collecting certain proofs of this great truth, which had remained unknown to all former or contemporary observers, and in discovering at the same time the principal antisoric remedy, which collectively are nearly a match for this thousand-headed monster of the disease in all its different developments and forms. So this is what you have to understand, that different development and forms is nothing but it is just one presentations of the chronic miasm is the sora. I have published my observations on this subject in the book titled The Chronic Disease, 4 volume, Dresden Arnold second editions, the self-of Skull. Before I had obtained this knowledge, I could only teach how to treat the whole number of the chronic disease as isolated individual maladies. See, understand why Master has given importance to miasm, because he knows that the discovery of homeopathy is not what most important, but the most important discovery is the discovery of this chronic disease or chronic miasm. So he said that previously what I used to do, before I had obtained this knowledge, I could only teach how to treat the whole number of the chronic disease as isolated or individual malady. So initially he tried to treat therapeutically by means of कि ये disease है ये दवाई दे दो. But then and then he came across that some disease came to repeatedly, and he cannot come over that. Then he found this disease, that is something is lurking behind, and that is the chronic miasm. With those medicinal substances whose pure effect had been tested on healthy persons up to that period, so that every cases of chronic disease was treated by my disciples according to the group of symptoms it presented, just like an idiopathic disease, and it was often so far cured that sick mankind rejoiced at the extensive remedial treasure already amassed by the new healing art. How much greater cause is there now for rejoicing that desired goal has been so much more nearly attained by finding out this theory or the understanding of the miasm, in as much as the recently discovered and far more specific homeopathic remedies for the chronic miasm. Here he had not put only one remedy. It is the homeopathic specific remedy for chronic affection arising from the sora. So there must not be only one antisoric. Master has given a several antisoric remedy. So that is means the sora doesn't mean that sulfur has the only indicated for the sora arising from the sora, and then properly named as antisoric remedy, and the special instructions for their preparations and employment have been published, and from among them, so preparations and employment has been published. So when you read the preface of the chronic disease, you will find out that how to prepare the medicines, how to employ this medicine in terms of oral route, in terms of the smelling, in terms of the drop doses, or in terms of the what potency. So all has instructions given in chronic disease preface. So he has written that, and the special instruction for the preparations and employment has been published. And from among them, the true physician can how select for his curative agent those whose medicinal symptoms correspond in the most similar homeopathic manner to the chronic disease he has to cure. So again he write in this line the law of similia, similibus curanter. Suitable for this miasm. So every time you have to prescribe the remedy which is suitable for the miasm. So sir always, Dr. Vijayakar always focus on the miasm because the miasm is the only missing stone and only key stone to prescribe in each and every case. So here master also tell about that the employment of the medicines curative agents which is based on the suitable for this miasm, and he is enabled to render more essential service and almost invariably to effect the perfect cure. So to cure perfectly and invariably you need to prescribe the medicine based on the suitable of this the miasm. So that is what the wisdom of Master Hahnemann telling us. So, friends, we all know how Sir has connected this knowledge and how Master has given this wisdom in his literature in the philosophical background. So, we are the generations that we are learning the wisdom of Master Samuel Hahnemann, and we are connecting it the wisdom of Dr. Prafull Vijayakar in the modern science, and then we evolve in such a manner. So that is what we are reading right now. And we will continue our journey of reading verbatim the workshop conducted by Dr. Prafull Vijayakar sir in Mahabaleshwar in 2002. So we are in the era of 2002, 20 years before. So we are reading the day 2 from this book. Up till now, we have covered the day 1. In day 1, we have learned about how to understand the follow-up in a proper sense, and then we understood can we handle the genetic disease and what can we offer in cases of genetic disease we are treating. So this is what we have learned with the modern science. Then we are reading the day 2. So day 2 it was conducted by Dr. Narendra Mehta. He is the best friend of Dr. Prafull Vijayakar. At the time when the predictive homeopathy has been established, there are a few stalwarts in the field of predictive homeopathy, and they have given everything according to the Dr. Vijayakar's methodology. So Dr. Narendra Mehta is one of the renowned homeopaths from the Mumbai, and he has adapted Sir's methodology and he presented the seminar in 2002. So Dr. Narendra Mehta presented a case of AMD, age-related macular degenerations. The 72 years old people visited in 2002 December. Now patient's monologue. How patient says that I cannot see near objects, so I consulted a local doctor in Valsad town near Mumbai. They could not diagnose my ailment. They asked me to consult some doctor in Navsari. I have consulted Dr. S and he said that there are three holes in the retina. I asked him whether I have to go to Bombay. He said that he would be able to do the treatment in Navsari itself. He operated me, but the operations failed. He gave me injection inside my left eye, but there was no improvement. My friend advised me to consult a good doctor, and hence I consulted Dr. Natarajan. He promised me that he could give 50% of my vision in affected eye, due to which I would be able to see but not read. After examining the right eye, he said that it might also have trouble in the future, and he found the fold and performed a small operations on the right eye, and the right eye was okay. But there was no improvement in the left eye, and I lost it completely, so I can see only with the right eye. It was my bad luck that I developed cataract in my right eye. My left eye was lost during the last cataract operation, and so it is not functioning for the long time. I developed cataract 2 years ago, and after the operation, there was no problem. But now I cannot see with my right eye since the past 7 months. So this is what again the patient become goes into syphilis. My health is very good, though I have renal stone since past 40 years. I get pain in and it pass away. I do not believe in allopathic medicines but in Ayurvedic, so I take Chandraprabha for this ailment. I had stone in both sides but more on my right side. I also had a problem in my ear. I could not hear and had this problem since childhood. I used to get pus in my ear. Since the last 2 years, my right ear is giving me trouble. I consulted an ENT specialist. If I blow my ears by closing my nose, my eardrum opens and I hear properly. I can manage with the hearing aids. I was well without any problem or tensions. I go to my farm and this is my routine. I am happy and have only one son. I do not have any sickness. I am used to taking Chandraprabha since long time and stone passes away in my urine. I take these medicines every morning and the bottle is always present on my dining table. This is what the routine he had. The major setback was in my recent eye problem. I started getting dimness of the visions. My friend said that this could be the because of the cataract operations. I have visited Bombay Hospital to see the same doctor who operated my cataract. He advised me three tablets after examining me on July 18, 2001. I was advised to take Chimeral Fort and other tablet for 1 month. Within 15 days, I got a reactions, I got the palpitations. I realized that it could be because of the tablet, and when I telephoned my doctor, he asked me to stop all the medicines. After that, though I felt better, I occasionally get palpitations. I have had 10 to 15 ECG, but all doctors said that they are normal. They said it is due to the tension of my eyes, but dimness of vision has no improvement. So this is what the story of the patient. I consulted Dr. Natarajan. He did an angiography of my eyes. He said it was due to age, wherein the blood cannot reach inside my eyes, and because of that, there is a dimness of the vision. He advised me eye drops 4 times a day. The further deteriorations in the dimness has stopped, but there is no improvement. I have never got a major ailment except for the fever sometime during the childhood. I have had a renal stone since 40 years. My health is very sound. I had a very hard upbringing coming from a poor family. I have worked hard and made my own house and farm. My only worry now is my son's marriage. I am very fun loving person and like to laugh and talk with everyone. I do not like serious faces and I always make an effort to laugh and joke all the time. I used to do regular exercise and weightlifting in my earlier days. Since the last 10 years, because of my old age, I have stopped. I still continue to do freehand exercise. I get up at 5 a.m. in the morning and go to sleep early in the night. Before my ailment, I used to walk at least 8 to 10 km every day. I am very soft-hearted person and have only one sister. I cannot bear to see anybody sad. I plan my work. I plan the previous night. I take regularly one lota jug of water from the copper vessels. I then start my exercise. I have a roti with my tea hot. I eat everything hot or cold. I take my tiffin box with me for lunch. We have dinner together at night. Nowadays, my family is always together because I cannot go out or ride my scooter. I am very particular in my works. I like to do everything by myself. If it is not possible by me, I make my workers do it in front of me. Then I am satisfied. I do not believe in rest. I am healthy, but have lost courage due to my eye problem. I do not have a choice in the clothes. During my childhood, I got shirts from my cousins and relatives. This is the first time that I have bought a ready-made shirt for myself. I was affected very badly when my mother expired. I was very attached to her. I could not make her happy. She dreams of seeing her son's house, but she had a paralytic attack during its construction. When my wife and I took care of her, my father and my sir were present when the house was built. But because my mother did not live to see it, my heart is sad. Even today, when I think of her, my eyes are full of tears. See the eyes moist in the video. I am contented with that what I have, and even if there is a loss in my business, I do not matter to it. It does not matter to me. Desire for the spicy food, warm tea, thirsty, very good. Stool and urine normal, sleep disturbed, thermal. I like the cold season, but not too cold. In the past years, I would wear a sweater and go about in my scooter, no matter how cold it was. But nowadays, I cannot bear very cold weather, and hence do not go out during this time. I know we need the monsoon, and without it, crops do not grow. But I do not like the monsoon, though I am a farmer, because during a rainy days I cannot go to the work. I am anxious that maybe things in this season will not go right. I was a counselor for 20 years. I would do service to the society without ever taking any money or taking advantage of my positions. But if anyone misunderstand me and if they malign my name, then I would cut off the relationship with them. Since our is a small town, the bad influence of the politics were not present like today. If the persons came to me and if there was a way in which I could help him by speaking to the municipality or the government office in my town, thus reducing his burden, then I would certainly use my influence and do what was needed. But I have never taken money directly or indirectly from anyone in the life. Now look at this, how the story of this person look like, and if we make the summary of this, what could be the thing comes in your mind? So let's have a little discussions in the chat box so that we can have what was the personality we are dealing with. A 76 years old man who is very very anxious about his complaint, and he came for this. He is very very conscious about something. He has a good heart. The morally he is very good. No bad moral at all. He is working hard, so conscientious and everything. So what could be the things comes into in your mind? Yeah, he can be very sensitive to something, very emotional, not able to see other sides, very conscientious. Yes, absolutely. So, very planner, exactly, very good. So, everything you have to keep note of that, and then we have to understand how the person sees. This 76-year-old man, yes, he can be very, very, yes, exactly. Anxiety about health, very workaholic, he is very, very positive because he went to many doctors to get rid of this disease, but he is not tired of that things. So that is what the things. Yes, he had the hatred, but he only said if someone misunderstood and used my name, then I do. But there is no any emotional process. Yes, he can be leadership, so he can use his power, esteem people. I had the childhood history of the ENT affections and everything. So from this history, we got certain clues and crux. So on the basis of that, we have to see if we have to prescribe the GCS to this man, what point we do we have to consider in this case? So we have understood that the patient has started his narration, so he is an extroverted kind of personality. Then we have to understand the will of the persons, we have to understand the moral of the persons, we have to understand the intellect of the persons, we have to understand the sensitivity, we have to understand the emotions, we have to understand the physical aspect, we have to understand the particular aspect. So on the basis of that, we have to calculate that the miasm is absolutely rightly said by Dr. Nisha, the psychosyphilitic. The physical symptoms, as Padmavati says, that bad effect of drugs and prolonged use. The man of the principle. So will is very good and strong will personality in front of us. He wanted to get rid of these things, and he is not tired and he is not timid. He is a very leader type of personality, the strong will personality. The intellect, the intelligence is very good, even though he is a farmer, but intellect is good. He came from the poor family and now he has built the house and farm and everything. So he is a man of principles and everything. And then he developed. Morally is very good. Emotions emotionally is very sensitive, and he has two things. He has anxiety for others, anxiety for health, and he also is very hardworking and emotional. Absolutely. Then how the sensitivity, he is sensitive to the sad things, those who are sad in the families, he is sensitive to that. Absolutely, he is attached to mother. uh, I don't directly go to the delusions, that delusion wealthy. Okay, it is our perceptions, but we have to find out certain things. Now, what is to be cured in the case? So we have some clues and some ideas about the things that this is the story of the patient. Now we have to understand what is to be cured in the disease. So let's understand the disease process by the understanding the anatomy of the eye. So the retina contain the 6 million cones and the 100 million rods. From them, the information passes to the nerve fiber and from them to the optic nerve. There are no photoreceptors at the optic disc, and therefore there is no light perception, and therefore optic disc is a blind spot in the visual field. Retina can be divided into the peripheral retina, macula, and the fovea centralis. So peripheral retina contains mainly rods and the few scattered cones. The visual acuity from this area is fairly coarse. Then macula, this is so called because histologically it looks like a yellow spot. It occupies an area of 4.5 mm in diameter lateral to the optic disc. This area of specialized retina can produce a high level of visual acuity. Cones are abundant here, but there are very few rods. Fovea centralis, the central uh, depressions at the center of the macula. Here the cones are the tightly packed, rods are absent. It is responsible for the highest level of visual acuity. Macula, this is an oval area at the posterior pole measuring about 5 in diameters, and in the retina it is the region of retina containing the xanthophylls pigment and more than one layer of the ganglionic cells. Fovea, this is the depressions of the inner retinal surface at the center of the macula, and it is a diameter of the 1.5 m. Ophthalmoscopically, the fovea can be recognized by the oval light reflex arising from the increased thickness of the retina and internal limited membrane in the parafoveal region. Parafoveal region is the thickest part of the retina, containing 6 to 8 layers of the ganglion cells, in the contrast to the retina outside the macula, which contain only one layer. So this is what very rich supply of the nerve, and which conduct the light perception to the nerve. The internal limiting membrane rapidly decreases in the thickness as it progresses from the parafoveal region toward the center of the fovea. Fovea, this forms of the central floor of the fovea, and this diameter is 0.35 mm. It is the thinnest part in the retina and is devoid of the ganglion cell. Its entire thickness consists only of cones and the nuclei, and it subserves the most acute vision. The umbo is a tiny depression in the very center of the fovea. Ophthalmologically visible is the foveolar reflex seen in the most normal eye. Loss of foveolar reflex is early sign of the damage. Now, now the discussion started like this. A person's working throughout his life fit till the age 72 now become a handicap. Only symptom pertaining to the disease are not important. The innate characteristic, the personality gives us more clue in such a case to give a result. And the video says observe the way he sits, the way he talks. Dr. Natarajan reports the fundal examinations. Dr. Natarajan is the ophthalmologist. The report shows the fundal examinations with the indirect ophthalmoscope reveal the evidence of the horseshoe tear sealed with a good photocoagulation mark and age-related macular degenerations with subretinal neovascularization in the right eye and attached retina with a pale disc in the left eye. He was advised to undergo FFA fluorescence fundoscopy angiography for the macula in the right eye, which he underwent on September 14, 2000. No treatment is possible for the left eye. On September 19, the FFA film was reviewed by me. There was edema in the right eye. There was no evidence of SNRV subretinal neovascularizations. So, what have you all observed? What is going through and through in this case? So all you have understood that the very conscientious, fastidious, industrious, sensitive, benevolent, and a strong, very positive personality we are dealing with. So now we have to find the way to sort out the rubric. Our remedy must be the rubric of positive. So this is what how Sir has calculated the will, intellect, and moral of the patient. So Sir has given the importance to the will. So at 72 years, most so this personality is very very positive, and so this is the rubric as given the positive. Before that, we will see the follow up. So understanding the follow-up, the first follow-up after 15 days, before this, the patient called me up and said that he had got some loose motion. So what to do? Should you treat loose motions? When to treat and when not to treat? What is the criteria to change or repeat the medicines? If the patient says that beside this loose motion, he has no other problem, he is doing fine, there is no weakness, there is no development of any other new symptoms. If person is healthy even with the 20 loose motion and he does his routine work, then we do not have any right to interfere. This is what Dr. Hahnemann has said. On follow-up, January 2001, the patient, I can see a little more brighter within 15 days. The dimness is completely less. Would feel the dark more previously. Any other changes? Patient like that I am happy only because of my vision. I was handicapped, but now I am going out of my house. Now I go alone to the farm. Previously, I would not even step out of my house because of my vision. Now I go for a daily walk all alone as the path is small. Two people cannot go together, but I have my servant with me to assist. Appetite is better now. Sleep is also much better. I go to bed around 9:30 and get up at 5 a.m. And now started my routine, started exercising, feeling fresh. Now I have some stamina. So this is what the follow-up, second follow-up said. Dr. Narendra Mehta, his general have now improved. His sleep is much better. He started going to farm, exercising, and his energy level also increased. Another follow-up, which is video. The patient says, I can see you now, the shirt, tie, and camera. Can you make out the color of my tie? The patient says blue and yellow. The patient, now I read newspaper. This I had stopped since 7 months. This has now started without reading. I do not get sleep. He had a habit of reading something daily before going to bed. I gave him a vision chart to read, which he read well. Patient says, I am 50% better. Now I now started driving a car and the scooter which I had completely stopped before. Doctor asks, are you comfortable while driving? No, I have become a little slow. That may be due to the age. Another follow-up in April, the patient now drives a scooter on his own. For 9 months, I was at home like a prisoner. Now I am very free. I can drive cars, the scooter. Previously, I used to come with my son. Today, I have come alone. I am very, very happy nowadays. When I go on the scooter or a car, my friend says, "See, Firoz is going. Firoz has become fine now. I used to come regularly to you all the way from Valsad." So, patient is traveling from Valsad to the Mumbai for the follow-up. Today, he tells people that this doctor is a person who does not give medicine for eye, but for everything. So, this is what the superiority of homeopathy, the victory of homeopathy by the told by the patients. In the May 2001, if your medicine is correct, it can change the patient's development, his family life, and everything. So this is what again we have read this. In previous chapter also, sir has said that if your medicine is right, the environment also change, the family life also change, and everything is changed. His son has now got engaged. He is very happy. His son says, "I am coming with you," and the patient says, "No need. I can go alone. I feel as if I am 50 years old, though he is 72 years old." See the energy level of the patient. So our is very great science, Dr. Vijayakar, make it easy as possible. How can we approach this case? So this is was the follow-up. Now what is the miasmable case? As all have rightly said that the miasm is psychotic and syphilitic. Psychosyphilitic going into destruction because there is a edema and then there is a destruction. So psychosyphilitic because there is a macular edema and also we are not getting any syphilitic symptom from the case. So you will get symptom as per the miasm present. Psychotic miasm is more prominent here. So what is the key symptom? So key symptoms is the will. So whenever you are treating the miasm, as we have uh, seen in the question answer session, that I have given you the approach to each and every cases. So whenever you are treating the psychosis or psychosyphilitic slow progressing disease, in that case you have to prescribe the GCS on the basis that you have to have a will, intellect, moral attachment, sensitivity, physical generals and physical particulars. So you all have to combine into this case. So now we are dealing with the patient who is very, very positive. So we have a rubric positive and the positive contain 13, 14 remedies in the repertories. So we have arsenic, causticum, camphor, ferrum, heparin, lactasis, mercury, nux vomica, sepia, androcanus, chocolate, hydrogen, ozone, etc. Now let us see one by one. So what is the arsenic? The arsenic is the theme of arsenic is insecurity. The arsenic pathology is deep-seated insecurity. They always depend on someone. Sorry. The arsenic pathology is deep-seated insecurity. They always depend on someone, require someone supports, fear of being alone. If I am sick, who will help me? So he is dependent and desire company. Always wants someone to be nearby. So he is has a fear of being alone. Here the patient is little different. Possessive. The arsenic is very possessive about the object, about the money, especially of the people, and Ars does not share his relationship with a give and take. He is very selfish, he is the taker, not the giver. In relations, he gives support to others and in return, he expects the same support. He is a miser, aware of saving monies and things, always calculating what return he will get. The fastidiousness, arsenic is very fastidious, rigid, and hard to please, wants everything neat and clean and perfect. He also become obsessive, also fastidious arising out of the insecurity. If I go to bad place, what if I fall sick? Obsessed by the need for the order and cleanliness to the point of expanding inordinate energy, constantly cleaning and straightening. This is the arsenic fastidiousness. It arises out of the anxiety and insecurity. There is anxiety about the health. On the other stage, the anxiety of health is increased and he is afraid to die. Here also there is an insecurity and he need company. Anxiety lead to the internal anguish and he become restless, mentally restless. He moves from chair to chair, place to place, seeking the security. paranoid, obsessive, or suspicious. If the arsenic patient is in a paranoid state, the fastidiousness will disappear, syphilitic, and anxiety and fear will diminish. There comes a stage of deep depression, despair of recovery, loss of interest in the life, and the suicidal thoughts. Suspicious of others, and the stage of insanity starts. He avoids talking to other people. Others become obstinate, introvert. There is no anxiety, no desire for company, no fear of death, no restlessness, and no fastidiousness in the syphilitic states. As the paranoid and delusion state is lifted, and the fear and later on the anxiety comes, it is the good sign. So this is what reversal. So if delusion comes, the fear started, then fear comes, the anxiety has been increasing. The patient has come from the syphilitic to psychotic, and from psychotic to the sorry. A homeopath with the true knowledge of the health and disease and miasm will recognize the progress in the direction toward the health. So this is what we have to keep in mind. Another positive remedy is the camphor. So camphor is always a crisis manager, so always positive in the crisis. So when unexpected situations comes, he takes the decision positively and comes out of the crisis. This is the positivity of camphor. The pain tolerance is quite high, but again think of this remedy in crisis when the pain is increased a lot. We start getting cold perspiration and there is a collapse. The patient is better while thinking of pain, and during semi-conscious condition is the pain is felt. There is a covering, there is a great coldness of the surface with desire to uncover. There is a great heat or sweat with desire to cover. So this is what the historical symptoms of the camphor. Contrary, again, contrary is the hysterical symptoms of the camphor. The patient has aversion to cover with the cold, though he feels cold. Desire cover when he is hot and sweating. This is again the hysterical. When there is a sudden collapse with the overpowering influence of the nervous system during crisis, he become contrary. So this is what very important. Sir always says whenever you find sudden collapse or a coma stage, and in that stage the patient is telling you keep fan on, suddenly he wants covering, and then patient says remove the covering. So these observations give that this is a contrary symptom specifically in the coma or semi-comatose state, and in that state you need to prescribe the camphor. Camphor is known to be a universal antidote to all the vegetable kingdom and all the poisoning. So in the poisoning you get the symptoms of excessive sweats and the collapse. Another remedy, the causticum. The causticum is initially excessively hypersensitive and overreactive, and later on he becomes has a gradual paralysis. So gradual is the keynote of the causticum. The causticum has a sensitivity to injustice, cannot support. He become anarchist, revolutionary like Mahatma Gandhi, and due to that he become a positive. He is very hypersensitive and overreactive. Why do they fight against the injustice? The causticum is easily excitable and quick to react. They absorb all the impressions from the environment, responding with the hyperactivity and overreactions, particularly in those functions governed by the nervous systems. Again, causticum goes into pessimistic. The person who was very revolutionary once upon a time, fighting for the world, now gradually become introvert, and whole energy which was diverted outside is now being diverted inside, and he now develop pathology. Here you get a disease like a myasthenia gravis, multiple sclerosis, and now weakness of the gradual onset and progress. And the patient persons can become imbecile. This will be diminished nervous system reflex, hard and short tendon, and the general state is inflexibility. So gradual is the key word of the causticum. There is no sudden development. It takes a long time for initial overreactivity to invert itself into a state of paralysis of the functions. Whereas imbecility, whereas he was once a very intellectual person, philosophizing, analyzing things deeply with a great capacity, he now starts feeling as if he is losing his mental power and slowly sliding into state of imbecility. So in summary, the causticum changes begins gradually with an initial hyperactivity, sensitive to injustice, authority, and anarchism, and the patient is aggravated by the dry cold with desire for salt and smoked meat and aversion to sweet. This is the crux of causticum. Another positive remedy is the Ferrum. So Ferrum always says, I am always right. He is an Iron Man, like a commander. He orders. Keyword of the Ferrum is contradictions. They are very, very sensitive to contradictions to all influence and all conditions. So excited, sensitive, and excitable words from the least contradictions. Slight noise like a crackling of paper is unbearable for the Ferrum personality. There is another three remedy. There is Asarum, Ferrum, and Theridion. They are sensitive to the slightest noise. Excited by the slightest oppositions, diarrhea comes on when the patient begins to eat. Again, we know the iron, the ferrum. The ferrum is the most important part in the development of the hemoglobin. So, due to the deficiency and defective assimilations, there is anemia. And even though anemia, it shows the false plethora on the face. So, again, it is a contradictions. There is a cardiac affections. Even in cardiac cases, the patient is aggravated by the rest and emulated by the slow and gentle motion. So, param is the remedy which is emulated by the slow and gentle motion. The palpitation and asthma is better by walking slowly, aggravated by rapid and sudden motion. This patient is chilly but like open airs, which relieves. So, again, here the contradictions. Sleep, during sleep, all the muscles relax and our eyes should close. Here, there is again a contradiction. The eyes are half open during the sleep. The pharum is like this. Another remedy from the positive group is Hepar sulf. The Hepar sulf is a very, very oversensitive remedy. They are sensitive to the slightest pressures. Hepar sulf is positivity, is oversensitivity. Because of his oversensitivity, his positivity comes out in his impulsive nature, and during that impulsiveness, he becomes positive. So he comes out of the crisis. If there is a fire or a riot, he will come out of it because of his impulsive nature. So keep in mind the certain key point. The patient appear as if his nerve ending are exposed and raw. They cannot take slightest pressures, either physical or mental. They become very angry, nasty, vicious, abusive to the other people. So these are the dispositions of the impulsive nature, nasty, angry, and oversensitivity. Hyper abuses other people because of their own intolerance to the pressure and stresses or the sufferings. They seem to hold other people responsible for their own problems. So the hepa mostly go into stage of necrosis, not in the autoimmunity. They become very angry, nasty, and abusive. This is the syphilitic state of hepa. Perspiration, the sweats day and night without the relief, sweats easily on the mental or physical exertion. Again, there is a rottenness, the offensive odors, the old cheese, rotten like, and the sour smelling, the stools and the perspirations. We all know the hepar is very hurry in nature, so next step there is a nervous excitement and which leads him to do everything in hurry. So the remedy is very fast, speaks fast, eats fast, drinks fast, etc. And the nervous system become very super excited. So another remedy is sulfuric acid, the fast sulfur, chili sulfur, acid sulfur. Another positive remedy from the positive rubric is the lachesis. So lachesis having a hyperstimulation, the primary target is the circulation. The snake remedy affect mostly the heart and the circulation. There is a overstimulation which constantly seek an outlet for the relief. Loquacity, this is an intelligent and the flow of idea is very fast, positive and loquacious and very intelligent. The idea flow fast, talks, change idea, jump from one topic to another. Emotions are very, very strong. They get easily attached to the people and object. Attachment is very strong. So lachesis is jealous, self-centered, suspicious, loquacious, talkative when there is a suppression of sex, and there is one of the main remedy for the religious affections. Suppression of the discharge. There is ameliorations by the discharge in all of India. The uterine pain ameliorated by the menstrual flow starts. The overstimulations of the sexual sphere, the lascivious, obscene, and the lewd. One of the main remedy for the masturbations, again because the patient is better after the discharge. So there is a remedy for masturbation is the Lachesis, Stephysagria, Platina, and Oregano. We all know that all the ophelia having a high affinity on the blood and it causes the disorganization of the blood producing the hemorrhage. People with the idiopathic high blood pressure, the flushing of the heat in different ages, hemorrhage with the dark color or the black floated blood from the nose, stomach, lung, uterus, bowel. So you can be think of the ophelia. The headache, varicose vein, hemorrhoids, and all kind of the heart ailments. We all know that Ophelia never sleeps, so sleep into difficulty, wakes up in the panic state. So this is what aggravation by the sleep in the morning, wakes up in the panic as the breath has stopped. Lachesis is the lead remedy, wakes up in the panic. Sensitive to the tight clothing around the collar, so they are sensitive to touch of the collar, neck band, clothes or necklace, even in the waist, unbearable. Another positive remedy, so we have a Merksol. So we all know the Merksol is same like the Haparsol, the angry, like a causticum, anarchist and revolutionary. This is the base of his positivity. The defense, the Mercury has a lack of reactive power coupled with its instability and inefficiency of the functions which enable it to create a stable, efficient equilibrium upon exposure to the many physical and emotional stimuli in the environment. The lack of defensive power resulting in sensitive to the everything, therefore Mercury gets aggravated by heat, cold, wet weather, warmth of the bed, perspirations, exertions, various food, etc. You all know when you take the mercury from the BP instrument in the hand, it cannot remain stable. So there must be instability everywhere. In repertory, in the italics and the bold, aggravated and emulated only 7 emulations, out of which 5 with lying down and 55 rubric in favor of aggravation. The mercury has a very narrow range of tolerance to everything. We all know the mercury is very impulsive. Mercury patient is more susceptible to every kind of the impulse. There is an impulse to strike, to smash things, to kill someone over a merely slight offense, or even kill loved ones. So this is the syphilitic aspect of the Mercury. Mercury is being so unstable, so it can losing the control over the nervous system and producing the tremor. So tremor runs throughout the remedy. This is the great weakness and trembling of the limbs due to the instability. There is a restlessness, as we know, the mercury is not solid. A little touch or it starts shaking, though liquid and heavy, then other liquid, it is unstable. So we all know that when we touch the mercury, there is very restlessness. Perspirations and salivations. So entry point is when we ask about rolling out mercury, we ask that is there is salivations at night, then the mercury can be the indicated. The easy perspirations does not relieve perspirations is normal functions to cool the body when it is overheated. Perspiration extracts toxic product, mercury perspire more even with a little stimulus, and also there is the excessive salivation. Another positive remedy is sepia. Sir always says the sepia is a negatively positive. So sepia has a condition called as miserable existence of their life, and out of that miserable existence of their life, they goes into a state of positivity and they develop the process. So out of that, they become a negatively positive. The sepia is the remedy is negatively positive. In sepia, we all know there is a stasis of the hormones, so there is aversion to sex, urge to being about the balance, to release excess of one or the other hormones. In sepia, there is no need for such release. The hormonal balance is equal, so there is an indifferent to everything from the sex to the pleasure. The body of sepia does not have the natural curves of the woman. She is thin, flat chest without the cause. There is a complete relaxation. The autonomic nervous system has two opposing forces that clash and become neutralized and result in the stasis. There is a sensation of the fullness in the rectum, the constipation without the urge, stasis of the uterus, prolapse, and drooling of the eyelid because of relaxations of the muscles. Indifference, the emotional state also has a stasis. The patient has aversion to sex, to her own husbands. He hates her children and she has no affection for them. She feels her husband is nice as long as he stay away from her in the bed. Later on, she hates him. This is her indifference to loved one and no emotion. There is a one word which is written in the Bogar. There is a stifled affection. So the affection becomes stifled. This is the sepia lady is. Sadness, there is anxiety, she cries days and nights, not working. Why? There is a great sadness with a tear because of the stasis. She cannot narrate her symptoms without weeping, aggravated from the consolations. There is a coldness of the body because of stasis in circulations, coldness of the legs and feet, and hands are cold and feet are warm, or vice versa. The coldness on top of head, coldness on the spot of extremity during the fever. This is the syphilitic particular of the sepia. So another remedy that is in the field of positivity rubric is Nux vomica. So Nux Vomica is very hardworking, strong sense of the duty. He is positive because he is very, very ambitious and workaholic, works day and night. He gives a lot of importance to the achievement and the competitions. Nux Vomica is competitive to the point of damaging his own health, even at the expense of his colleagues. He is workaholic, dominated by the work. He gets promoted easily. He is very, very fastidious and efficient. Fastidious is more appropriate to the reality. Stimulant, it is difficult for Nux vomica patient to accept the limitations of anything. He cannot resign. To keep up with the pressure, he uses various stimulants like the cigarette, coffee, drug, alcohol, tea, or even sex. The man of the modern era. I used to learn Naxwamika in the three W, wine, wealth, and woman. So they want the three things: the wine, the wealth, and the woman. So this is what they want. They want every luxury by getting the wealth into everything. They want the wine that is a stimulus to everything, and they want the woman that is what they want the enjoyment of the life with the sex and everything. So this is what the Naxwamika is sensitive. Despite such abuse of stimulants, he is so much so sensitive to many of the substance. They are hypersexual individuals, the strong desire and male energy in their sexual impulses, the moral feeling want of is the syphilitic aspect of the nux vomica. Overindulgence of the stimulants may meet his need, but later on toxicity develop and entire nervous system become overwhelmed and he become oversensitive to light, noise, and etc. His mind is constantly hurried from one thing to another until he is tortured. There is a constant irritability. He goes home and thinks his work. He lies awake at night with constant thought of business and the affair of the day crowded upon him and finally suffer from the brain fag. When detail comes to him, he gets angry and wants to get rid of it. He tears things up, scolds, goes home and take it out on his family and children and feels better after vomiting. So irritable inside. You ask, are you irritable? The patient says, no, not at all. Always. It happens with everyone. I never even raise my voice. How about inside? Do you feel irritable inside yourself? The patient says, oh yes, very much. It is all due to abuse of stimulant. His irritability starts when he cannot cope up with the work. There is increased workload and responsibility. He cannot manage to do it. He loses his temper on the small matter. If he cannot find his things, he becomes very irritable. He walks out of the room loudly slamming the door. He is intolerant to the contradiction. And the sleepless wakens at 3 a.m. with the business affairs crowded on him. He cannot sleep and sleep again in the morning. Now, we need to find out the constitutional remedy. We have read all the positive remedy with their dispositions and everything. Now, we have to fit this, which remedy fit into this case. So we have to go to the constitutional medicines. For that, we need a physical makeup, mental makeup, and general makeup. So in physical makeup, we know that is a strong built personality, 72 years. The mental makeup, very positive, conscientious, very cheerful, industrious, and ardent persons. General makeup, chilly, desire for stimulant, desire for hot tea, and abuse of medicaments. So right straight away we land up with the only remedy, that is nux vomica. After repetition, the remedy comes up is nux vomica. So the patient was given nux vomica 200 single dose. So we have to match the fundamental nature of the patient with the fundamental nature of the remedy. The fundamental nature of the nux vomica is self-reliant, independent, compulsive, hardworking, overly efficient. So this is the things, and we already seen the fall off. So after the single dose of nux vomica, his rods and cones have stimulated and it regrow and the vision has get back. So that is what the destruction has stopped and construction has been started, and in the fall off we can see, and his generals has also improved. So this is what the things, whenever you didn't find out after this reading of this case, what was the crux of this? If you did find any syphilitic things or any perception of the patient, no worries. You have to go to this line of process, that you have to take the physical makeup, the mental makeup, which is innate in characteristics right from the childhood to till this age, and take that positive point into consideration so that you will get the right GCS. This is the crux of understanding this case. Hope you all understood this in a proper way. So from tomorrow we will continue with the chapter 4. So thank you for being with us. Yes, single dose, 200 potency, no repetition has been done in this case. And it is possible. We have seen many cases, sir has given a single dose and sir waited for 3 years and everything went in the right direction. So it can possible with the single dose only. So thank you so much for being with us in the learning. We will continue our session tomorrow. Thank you all. So we call the day off today. Thank you. Thank you so much.